our bodies relying on a vast, intricate network of internal roadways, our arteries, to efficiently deliver vital nutrients and oxygen to every cell. Imagine what happens when those critical pathways begin to lose their natural flexibility and start to stiffen. It is a silent and often unnoticed process that can have profound long-term consequences for your overall health. Yes, high cholesterol absolutely causes arteries to harden over time. This significant hardening process, known as atherosclerosis, is a major underlying factor in several serious health conditions, including heart disease, peripheral artery disease, and stroke. It is incredibly important to understand precisely how this happens so you can take informed steps to protect your cardiovascular health and, specifically, your brain. The primary driver behind this arterial hardening is an excessive amount of low-density lipoprotein cholesterol, which is frequently referred to as LDL cholesterol, circulating within your bloodstream. When there is a high concentration of LDL, these particles can start to penetrate and accumulate within the delicate inner lining of your artery walls. You can visualize this process much like how a gradual buildup of rust or sludge can narrow and stiffen a water pipe. Over many months and years, these accumulating deposits, which are comprised of cholesterol, cellular waste products, and calcium, from what is known as plaque. This plaque is not merely a passive blockage. Its presence actively triggers a complex inflammatory response from your body's immune system. This chronic inflammation, combined with the growing plaque, directly leads to the artery walls becoming progressively thicker, much stiffer, and significantly less elastic. This detrimental condition is precisely what medical professionals refer to as atherosclerosis, literally meaning the hardening of the arteries. In contrast, high-density lipoprotein cholesterol, or HDL cholesterol, plays a beneficial role by actively helping to remove excess cholesterol from your arteries and transport it back to the liver for processing. It acts like a crucial cleanup crew, preventing and even reversing some of the plaque buildup. To effectively prevent or at least significantly slow down this arterial hardening, there are several proactive and impactful actions you can integrate into your daily life. Adopting a heart-healthy diet is paramount. This means emphasizing an abundance of fresh fruits, colorful vegetables, and whole grains, while consciously limiting your intake of saturated and trans fats, found often in processed foods and certain meats. Regular physical activity is another cornerstone, as it plays a critical role in maintaining healthy cholesterol levels, strengthening your heart muscle, and enhancing artery flexibility. Aim for at least 150 minutes of moderate intensity exercise each week. Furthermore, getting regular preventative checkups with your doctor is essential. These visits allow you to consistently monitor your cholesterol levels, blood pressure, and other important markers, enabling early intervention if your numbers start to shift. Your healthcare provider can help you fully understand your specific risk factors, interpret your cholesterol panel, and work with you to create a personalized plan to maintain or improve your arterial health. Understanding the distinct roles of LDL, often dubbed bad cholesterol, and HDL, known as good cholesterol, is truly an empowering piece of knowledge for your health journey. When LDL cholesterol forms plaque within the artery walls, it is not just physically obstructing blood flow. It is also initiating inflammation and causing microscopic damage to the artery's structural integrity. This combination makes the artery wall more rigid, more susceptible to future damage, and significantly increases the risk of a plaque rupture, which can lead to a blood clot. This intricate and silent process of atherosclerosis develops insidiously over many years, often without any noticeable symptoms until a significant event occurs, underscoring the critical importance of early and consistent cholesterol management. A diet rich in soluble fiber, found in oats and beans, and plant sterols can also play a vital role in reducing LDL absorption. By consistently taking proactive and informed steps to manage your cholesterol levels, you are not merely addressing a number. You are actively preserving the natural flexibility and overall health of your arteries. This diligent care helps ensure that blood flows smoothly and unimpeded throughout your entire circulatory system, significantly reducing your lifetime risk of developing serious cardiovascular events such as heart attacks and, most importantly, strokes. Maintaining healthy, pliable arteries means your heart does not have to exert excessive effort, and every organ, especially your brain, consistently receives the steady, rich blood supply it absolutely needs to function optimally and keep you feeling your best.